Peripheral arterial disease, or PAD, affects about 8 million Americans. It becomes more common as we get older and can signal other circulatory problems. Here to talk about PAD and its risks, symptoms, and treatment is interventional radiologist Dr. Aaron Montgomery with Sacred Heart Health System. Thanks for being here, Dr. Montgomery.
Thank you.
Well, I know you're located on the Sacred Heart campus, but tell us what practice are you with?
Coastal vascular and interventional.
Okay, great. Well, tell us about this big word that I'm having trouble pronouncing here. What is PAD?
PAD is peripheral, meaning your periphery, as opposed to being central, meaning the heart. Arterial, meaning the arteries, and disease. What it is hardening of the arteries, where you have plaques build up inside the arteries and block flow to vital organs sometimes, and other times just down to the legs.
Well, why does it become more common as people age?
Well, we just get experience on our body, and the good foods that we eat. The smoking is always a bad factor. Diabetes is another bad factor. And all those compound over the years and slowly build up blockages.
Well, you mentioned legs when you were explaining that. Is this something that is very common in the legs?
Yes. Right now we're looking at 8 million people are afflicted with this. Because the baby boom generation's getting older, we're looking at 20 million by 2020. So it's increasing.
So why is this so dangerous?
Well, the fact that you have this is an indicator that you may have a major coronary event within 5 years. So early detection is key, and that may be your only warning sign that a major cardiac event is coming.
Well, I know people are fairly educated about heart attacks and what they might feel and that type of thing, but what kind of symptoms would someone with PAD experience?
The most common thing is that they have cramping of the calves when they walk. And they may walk a couple blocks, have to rest, the cramping will go away, and then they can go again. Unfortunately, most people write it off as they're just getting older and think they just need to take more breaks, when actually it's a blocked artery.
So how would they know to have that conversation with their family practitioner or to seek help from someone like yourself? How do they know this, hey, this is really something I need to check out? And then how would they proceed about doing that? Well,
if you're having the symptoms of cramping while you're walking, that's always something that should tip you off. The easiest way to find out if there's a problem is to do what's called an ABI. And what that is your ankle and arm blood pressure, and you do a ratio between the two of them. And your blood pressure should be the same all over your body. Mm-hmm. If there's discrepancy, that means we got a blockage somewhere. And that's a simple, painless thing that's offered all over the place, mm-hmm. Within the community.
Well, we're talking about legs. Does this also affect the arms?
It does, but it's very rare. And it's when it does affect the arms, it's usually not as noticeable.
Okay. Well, what information is important for them to transmit to their doctor? Just describe what they're feeling as far as these cramps. Are there any lifestyle information? How should they go about having this conversation with a medical practitioner?
Well, you should feel free to talk to your doctor about anything, but going and saying that, I'm having this problem and it is becoming progressive. Having cold feet, having pain at night is another big symptom that people will show up with. So it's, mm-hmm. a lot of factors out there that if people are just curious, go ask your doctor.
And check it out. Mm-hmm. So, tell us a little bit about what kind of treatment is available.
There's a lot of treatments nowadays. There is some drug therapy, but it is very limited. Now you do have the ability where we actually go inside the artery and we can stretch the artery back open by either using balloons or stents. We can actually shave out those blockages now. So there's a lot of different tools that we have out there to treat this disease without actually doing any surgery. In the most extreme cases, they do bypasses to totally bypass the blocked artery.
So how do they go in and do the stent and the balloon? Tell us a little bit. So it's it's not a major surgery, or how do they do that?
What we do is we numb you up over the common femoral artery, put a needle into the common femoral artery, put a wire through that needle, take the needle out, put a catheter in, inject the dye, and see where the blockage is, and then advance that catheter across the blockage, and then advance a balloon across there. Inflate the balloon, deflate the balloon, we're done.
You're done. Well, what about resuming a healthy lifestyle or an active lifestyle after the fact? What can they expect after having this treated?
If we treat with a stent or shaving the blockage out, we want you taking it easy the next day. After that, have at it. Try out your new legs.
Well, why do you think that this is something that people may not be as informed about?
Most people think that it's just part of growing older. It affects the older population. They think that it's just part of life. The other thing is that before there wasn't many treatment options. The number one treatment option was amputation. And people
not one that people are interested in,
no,
I'm sure.
They were not interested in pursuing that at all. So it's not been discussed very much.
Well, if people are having this, should they continue to exercise or to walk, during that time when they're, trying to determine this and while they're waiting to have some treatment done? Is this something they should just stop all activity, or how does that factor in?
No, the use it or lose it principle comes into play. The more you use it, the more you use those muscles, the more your body's going to demand blood flow. And it'll allow the vessels that are open to dilate more to get more blood flow down there. If you stop doing anything, they will get smaller, doesn't need much blood supply, so your body's not going to try to develop any bypass on its own to get blood down there.
Mm-hmm. Well, I know there's a lot of information out there. Where would you suggest our viewers learn a little bit more?
They can check our website. There are the Society of Interventional Radiology. They have the PAD Coalition. Legs for Life has a website as well. There's a lot out there. Even the drug makers for different products will have sites out there where they have more information on it.
Okay. So if you had one last thing to say to our viewers about this and about seeking treatment, what would your advice be? Get checked.
Get checked before it becomes too late, before you develop something that you do not have the blood supply to heal. That can always lead to an amputation. It's simple, it's painless to get checked, so get checked.
Great advice. Well, thank you for being here. We appreciate it.
Thank you.